Thank you very much for inviting me. I'm really pleased to be here on behalf of the Dryden Area Family Health Team and the Dryden Regional Health Centre, and to share our stories that we've gone through in our journey through primary care, and really our journey through It's Your Health. Our goal was to improve access to chronic disease management and prevention, to health promotion and prevention, mental health services, and to empower patients to really take control of their own life. So every time we talk about the Dryden Area Family Health Team, one of the taglines we continually add on is It's Your Health. We really want to provide patients with the tools. So when we started in Dryden, the process started approximately 5-6 years ago when they started looking at a family health team and the differences they can make in the community. And one of the quotes I really like are, "Some look at things that are and ask why. I dream of things that never were and ask why not." We really are striving in our community to really ask why not? Why can we not make the changes? Why can we not implement new programs and services for our community and increase access or empower patients? So the vision of the family health team when we started out, we have approximately 11,000 patients that the family health team serves. We were striving together as a group to use our resources effectively, to use our resources for efficient and quality care, and to ensure that we had a common purpose of improving the health status for the Dryden residents. And we did this by integrating, collaborating, and partnering with the community, with the different agencies, and with the patients and the providers within the community. So the Dryden Area Family Health Team consists of the members that you see there. We're in a new location, or it's a new site that's attached to the clinic. We have 8 family physicians, nurse practitioners, registered nurses, mental health counselors. It was really exciting. We had the physicians appreciated and valued the work of the RPNs. They hired their additional RPN to add to the RPNs that we were funded for, so that was a success. We partner with the Northern Diabetes Health Network. They're located right in our building, right on our site. They access the EMR system, which ensures that we have information that's shared right across the team, so that really program has proven to be quite successful. We have a clinical pharmacist, diabetes nurse educators, and then the administration staff as well. So we're a large team that has now been added into Dryden. We're under the governance of the Dryden Regional Health Centre, so by doing that, really what's happened is primary care and acute care are working together, we're collaborating, and we're ensuring a seamless flow between the two organizations, or striving towards a seamless flow between the two organizations as well. Now, these are a few of our community stakeholders. We certainly are increasing our partnership as we move forward. This doesn't include our regional partners, it doesn't include our provincial, our national partners, and the pictures there that you see, the pictures there that you see there are, in one day or within a day and a half, we met with 1,500 children in our community, partnered with the CDA, the Canadian Diabetes Association, gave them all T-shirts, went out with a message of making healthy choices, the best choices they could make for nutrition, physical activity. And we really enjoyed meeting the children and providing that message to them. So that's a snapshot of a few of the children. If you can imagine, times that by 1,500. It really has been a successful partnership that we've done. So we certainly do value our partnerships and our stakeholders that are involved in our community. So our program, so that was basically the highlight of who we are. Our program is called It's Your Health, and the It's Your Health program has 3 components. The first component there is healthy living, and I'm going to focus more on the chronic disease, the manage your health, but the healthy living piece is group or individual. It provides people with access to health promotion programs. We go into the community. We are striving to meet the community where they're at, where their needs are at. We go into workplaces, schools, senior supportive housing units, to ensure that people have access to the health promotion and prevention program. Within that program as well, we're doing screening clinics, and it really has proven to be an excellent program, and we met with approximately 2,300 people in our community within approximately 8 months, and we found that that was an excellent outreach. It also provided us with the opportunity to talk about the Dryden Area Family Health Team and ensure that our information was out there, and we still struggle a little with that, trying to make sure people are aware of the chronic disease programs, aware of the health promotion, mental health programs, so that people know where to go for help and how to access the services. So that was definitely an excellent tool for that. Manage Your Health, which I'm going to briefly touch on, focuses on chronic disease management prevention. It is run through different providers such as registered dietitian, registered nurses, mental health therapists, clinical pharmacist, and all of the different programs that we've delivered there are group or individual, and they run from asthma, COPD, diabetes, hypertension, cardiovascular, stroke, and lipids. So, and sorry, arthritis as well. So within that program, the group or the individual, depending on the patient's needs, really matches the final piece, because even though we might see them in a group base, we also recognize we need to see them individually, and that's Your Health Toolkit. So that's the last piece of the pie there. And under Your Health Toolkit, it's all the individual appointments that a person might need between the nurse practitioner, the physicians, the blood pressure follow-ups, the INRs with the registered practical nurses, and such. So the goal of the It's Your Health program is to really, at the end of the day, improve patient health. As I said, it's offered in group and individual sessions. We navigate the patients through the program. We have a patient navigator on a very limited basis, just with staffing ratios. But this registered nurse meets with the patients. They go through the patient's goals and objectives. What we're finding is the number of the patients that are coming into our program are living with multiple chronic diseases. So ensuring that we're able to navigate them through the system, access other services, and negotiate other services they might need within the community or within our own system. They set goals, so if they're coming into the program, they're setting goals, what they're going to work on today, what they're going to work on next. We encourage them to set one goal, and interestingly enough, some of our patients would come into that program and say, well, no, you're the provider, you tell me what I'm supposed to do. And others come in and they want to pick 3 goals. So it really, we're trying to educate people as well, provide the self-management tools, provide the education and resources to ensure that people have access, and that we're linking them to the resources that they need. So it's not something to tell them that they need to eat healthier, but providing them with the resources and tools to show them how, or to discuss their lifestyle and where they're at within their homes and how we can improve upon that. We utilized the Ontario Chronic Disease Prevention Management Framework, and the only reason I brought this slide up is because under each area, when we went into planning approximately 3 years ago, we ensured that under each section of the framework, we identified tasks that we could work on for each chronic disease. So for hypertension, there's tasks under information systems, provider support, delivery system, community action, personal skills and self-management. And we found that was a really good tool to get us started. And it was really helpful to focus on ensuring that we were prepared and proactive for what the patient's needs were when they're coming in to the family health team.